All right, guys, let's talk IVs. I love talking about IVs because so many people don't understand them, and I love educating, okay? So, first off, what is an actual IV? So, a lot of people think that the bag is what an IV is. That is not the IV. The actual IV is a little thing that is in your arm. That is the actual IV. The bag is just the bag of fluids. It is whatever fluids the doctor orders. Sometimes it's actually medication that's hanging, okay? So let's talk about the different type of IVs that there are. So if you ask me, this is the worst part about travel nursing to me, okay? To me. This is my opinion. There are different type of IVs. So there is this. This IV has, as you can see, a little wing on it, and it helps you put it in. There's this type of IV that has no wings on it, and she's just kind of hanging out there, and it comes like this. And then you have IVs that come with this big old thing to kind of help put it in. So as you can see, these are all different colors, and the reason why they're different colors is because the color tells you how big the gauge is. So the smallest one that I have for today is a 22 gauge. I'm not sure if this is actually in camera or not, but this is a 22 gauge. We typically use this one with our pediatric patients. A lot of patients will be like, give me a butterfly, give me a butterfly. Yeah, this is not the butterfly, okay? This is not, any IV is not a butterfly. So what makes something a butterfly? A butterfly means that you're using a really small needle, but also it means that you're just drawing blood, okay? Unfortunately, butterflies aren't IVs because we need to actually get into the vein so we can give you guys medications, we can give you guys fluids, okay? Next up, we have our 20 gauge. Now this baby right here, this is what pretty much every single adult patient should be stuck with. And I know some people are gonna be like, no, my veins are way too small for that. The reason why we are trying to stick you with at least a 20 gauge is not because we are rude people or being mean to you or anything like that. And the reason why is because at most places, you need at least a 20 gauge to be able to give blood. And most of the time you get an IV started, it's in the emergency room, and we have no idea what's going on. We don't know what your hemoglobin is going to be. We don't know what all is going to transpire to, maybe you're going to get a blood transfusion. Maybe you have to go to the operating room. So most of the time you need a 20 gauge. Another reason why you need a 20 gauge is because certain CTs, aka CAT scans, they need at least a 20 gauge to be able to do your CAT scan if the doctor orders it with dye. And the reason why they need at least a 20 gauge is because the bigger, of course, the needle is, the bigger the straw is that is in your arm. I don't think I went over that, so let's get into that too. So when you insert, this is the part, so let's say your skin is right here. When the nurse goes to insert this IV in, they're going to put it in, and then they're going to, in this case, on this one that I like, you push this part up, and as you can see right here, this is the catheter. This is the part that stays in your body. This needle is being retracted, and they'll click in this one, and you twist it off. The needle goes bye-bye. The needle does not stay in your arm. The only part that is actually in your arm is just this catheter. So that way we can give you fluids and medications through the catheter that is in your body. So the bigger the needle is, that means bigger the little catheter is going to be, which means that they're going to be able to push the contrast dye, push the medications, push the fluids in faster. So that's why we like to use a bigger size gauge, aka bigger size needle. Next up, we have our 18 gauge. I love green, okay? So this is our 18 gauge. She's okay. She's all right. The reason why I love 18 gauges is because you can get stuff done. And also, one of the hospitals that I worked at, in order to get a CT with contrast, at least for a chest in most cases, the hospital I worked at, instead of it being a 20 gauge, you needed at least an 18 gauge, okay? So pretty much everyone had to be stuck with an 18 gauge. If you did not get it in the ER, all of the trauma nurse specialists, they were trained on how to do ultrasound guided IVs, so they would just pop one in for you. Like If it wasn't green, it had to go, unless you had like a sickle celler who had horrible veins. In that case, you would use one even smaller than this, and you use a 24, which is one step below. So I'm not sure if you guys have been paying attention, but the bigger size, aka of the gauge, is actually a smaller needle. So 24 gauge is a super small needle that's used for kids, versus an 18 gauge is what's used for your typical adult patient. There is a bigger size. It is a 16 gauge needle. I use that a lot, actually. When I worked at the level 1 trauma center that I worked at, we would always try to put in at least a 16 gauge or 18 gauge, just because these are trauma patients. Trauma patients require a lot of fluids and obviously potentially blood. Some trauma patients, no matter what, if they get hit inside the box, they are taken to the OR. And if you're going to the OR, you should assume that you're also going to give blood, because you're cutting into something. You got to replace what you're taking out. So that is pretty much the standard for that. And also, a few times we have done a massive transfusion protocol. So you are quickly giving patients blood. You're quickly giving them plasma. You're quickly giving them platelets. I'm also glad that I brought up the word plasma, because I recently donated plasma and I was super duper nervous just because I am a heart stick. So this is an 18 gauge. What they stick you with to donate plasma is a 17 gauge. So it's actually even bigger than this needle. And I'm not going to lie, when I was sitting there on the chair and I looked down and I saw it said 17 gauge, I said, oh. And I said, okay, this is payback for all the 16 gauge IVs that I started on patients, I guess. Like, dang, okay. I'm like, I'll never say a thing ever again. So when you're starting an ultrasound guided IV, as in its name, you at least need an ultrasound machine. Sometimes you don't have an ultrasound machine readily available to you, so you can't do the ultrasound guided IV. Other equipment that you need a longer needle. You're using the ultrasound to look deeper at different veins that may potentially be there. This little needle is not going to cut it. And actually, when you start an ultrasound guided IV, instead of going at this angle for regular IVs, you actually go more like a 90-degree angle. You get down in there and then you level it out. So it takes an ultrasound, it takes longer needles, it takes a person who specializes. So unfortunately, we can't always use the machine to start an IV. There is a couple other things that we can do when we immediately need to start an IV on someone. And I say that because, like trauma patients, there's normally not enough time to wheel in the ultrasound, get the actual ultrasound guided IV nurse in there, do all this stuff. Sometimes, like when the patient's coding or when it's just an emergency, you have to go to other measures. So one of the things that you can do is you can do an IO. An IO is basically drilling into someone's bone. So IO stands for interosseous. So the typical bones that we use is your humerus, which is supposed to be like the best place to do it, and then your tib fin. So you get the little drill, you put on the needle, you drill into someone's bone. The worst part, they say that when you drill, it's the same pain as when you start an IV. But apparently the worst part about getting IO is when you flush in fluids. So if you have time, if you have lidocaine readily available to you, once you get drilled, or once you drill, you push lidocaine, that is a numbing agent, and then you flush it with saline so that way it doesn't hurt. Apparently when you flush out the bone, that is the worst part. That's why we give lidocaine. So I have IO'd a few people. Unfortunately, I guess fortunately, it is common in kids because it is obviously harder to find IVs in kids. So they are typically IO'd. Most of your full arrest, aka people who you are actively doing CPR on, they will get IO'd. There are a few contraindications to getting IO'd. You have like osteoporosis. Obviously, if you have a prosthetic limb, that's not going to work. fun fact, if you think this stuff is fun, back in like the war days and stuff, they would drill into people's sternums. So let's just be thankful that we don't drill into people's sternums anymore. I cannot imagine waking up and seeing a huge needle in my sternum. But that is just one other route that we can go to be able to get a good IV access. And why is IV access so good? So IVs, they allow us to give medications to patients rapidly. So we can rapidly hydrate a patient, we can rapidly give blood to a patient, but also when you give medications IV, it works a whole lot faster. So typically for IV medications, the onset is about 1 to like max 5 minutes. As shots, when you do something IM, intramuscular, or sub-Q, subcutaneously, like in the fat, that takes about 15 to 30 minutes for the medication to start working. And then of course for pills normally, or PO, that orally, that takes about 30 minutes to an hour to start working. So if you have a really sick patient, if a patient just broke their leg and they're screaming in pain, do you think I'm going to be like, oh, here's a little Norco for you, it's going to work in like an hour? No, we are going to start an IV. We're going to push them some fentanyl. We're going to push them some morphine, so that way they can start feeling good in about a minute or so. So that is the advantages of an IV. Let me know if you have any questions, if you want to learn some more about the IO or ultrasound guided IVs, or any other questions you have. I was thinking about also doing a video on different fluids. There's your typical 0.9, but there's also 0.45, there's dextrose, there's saline, there's so much. And there's also a saline shortage right now. So let me know if you guys want some more information on that and tips and tricks on how I was able to memorize what did what.